Hello and welcome to Natural Healing with Oriental Medicine. I'm Grant Boxleiter. I'm joined by Dr. Stephen Wrench of East West College of Natural Medicine. Our topic is treating back pain, and right now I'd like to send it out to the president of East West College, Russell Badiata.
Thank you, Grant. I'm Russ Badiata, campus president at East West College of Natural Medicine. Back pain is the most common complaint among American adults. It's the leading cause of lost time at work. 80% of all adults will experience some form of back pain during their lifetime. I myself know the horrors of living with back pain, but I also know the relief that is provided by Oriental medicine. On today's program, we'll discuss some of the most common causes of spinal pain and methods of treatment using Oriental medicine.
Thank you for that. So, Dr. Wrench, how common is lower back pain here in the U.S.?
It's very common, Grant. About 8 out of 10 Americans will suffer from low back pain in their lifetime.
80%?
Yeah, 80%. On a more global scale, we would say 10% around the world will experience it. Of the people that do suffer, 10% will never really know the root cause of their problem. 7% will be chronic. It's the fifth leading cause of doctor visits annually.
Now, when you say chronic, that means it kind of lingers, hangs around.
Yeah, and even in an acute case, expect to be suffering to some degree for a period of about 3 months. At least surveys indicate this. And in a recent study, we've seen that of 638 people, back pain was chronic in 7% of those people, so they expect it to be around for a long time.
So lots of patients to help in this issue.
Absolutely.
So how much do we spend on the treatment of back pain annually just in this country?
Well, those that suffer spend about $3,000 a year more, and I'll give you a little bit more involved figure here. We spend about $86 billion a year treating patients and pain. But the more indirect costs are loss of wages and loss of productivity at about $110 billion annually.
So that not only costs the patient, it costs the employers, it costs the economy.
Absolutely.
Interesting. So what would be some of the common pathologies of this back pain? What are the root causes?
Well, we'll start with the simple stuff. Acute lumbar sprain, which is really just when we sprain our back, like we reach into the car to pick something up out of the trunk. Acute lumbar sprain, a sprain we might say is the overstretching or tearing of the collagen fibers of ligament structures that hold bones to other bones.
Because we know the back is made up of several muscles, right?
Oh, many muscles. And many moving parts, 26 to be exact. We also have muscle strain, which is little micro tearing of the muscle fibers. We also have what's called a subluxation, when a vertebral body shifts out of its normal position, placing pressure on other nerves around it, like spondylolisthesis, which is the forward slippage of one vertebrae upon another. Two of the primary causes are also what's called spinal stenosis. And we have little canals or channels through which nerve endings pass, and I kind of make a little circle like this with my hand. And spinal
so the nerve
stenosis
is tucked in there?
Yeah, it passes through the passageway. And stenosis is literally the closing off of this space, which puts pressure on nerves, causing pain and loss of range of motion.
Now, is this sharp pain all the time, or it could be a dull pain? It just varies, I would assume.
It can, depending on, when it's acute, it's usually very, very sharp. The other cause is what we call prolapse or herniation. Disc herniation, if you imagine vertebral bodies are kind of cylindrical in shape. They rest upon one another, except they're spaced. And these little natural spacers or shock absorbers called intervertebral discs. It's like a jelly donut, Grant. You have a tough outer core called the annulus fibrosus, but the soft inner jelly core is called nucleus pulposus. Through desiccation or dehydration, we dry out as we get older.
So almost a gel that has a little bit of elasticity to it?
Exactly. Well, the disc itself does. The gel is just a soft, spongy core like Jell-O. And as we get older, we dry out a little bit, and these things form little cracks, or it tends to dehydrate, which makes it more susceptible to rupture. When that happens, the jelly core passes out into the spinal canal, puts pressure on nerves, and can cause very debilitating pain.
Yes, and when we talk about other forms of lower back pain, even sciatica, I know that in some cases it starts in that lower back, either on the left side or even the right, and it shoots down your leg, but that part in the lower back can be really debilitating in some people.
Well, you have 13 miles of nerves in a human body, 150 million nerve cells. The sciatic nerve itself is the longest nerve in a human body. And when we get pressure on that nerve root, it can travel all the way down the leg, causing pain that's burning like, and numbness and tingling in the foot. It's often referred to as the longest river of pain in a human body.
Wow, yeah, and I've experienced this at least in a mild scale. But so let's talk now about some of the various methods of treatment sought out by these back pain sufferers. There are quite a few, I would think.
Well, there was a study of around 700 patients, and they found that 58% of the patients surveyed in this study said they sought relief from prescription pain medications and/or anti-inflammatories and so on. 54% said that they chose chiropractic care for their method of relief from the pain, and 48% chose physical therapy. But interestingly, in another study, the largest group of reporting pain relief were people that sought regular acupuncture treatments at least 2 times a week for 4 to 6 weeks.
So the acupuncture treatment is something that a lot of people get that treatment and feel better. And we're going to see more of that as we go through the show.
We are. And keep in mind, too, that many forms of treatment can be a little invasive, can be even painful. And I'm a big believer in chiropractic, and I've had my share of physical therapy. And these are all wonderful forms of treatment and quite necessary. But in and of itself, acupuncture isn't painful, and not to imply that these other things are. But sometimes when you're hurt, you want something that's less invasive.
It's not as intrusive or invasive. Yeah, it's certainly something that you do it and then it's over and then you go on with your day.
We also didn't mention osteoarthritis. And since we're both, I'm safe in assuming, over 40, probably you and I, if we x-rayed us head to toe, we would show radiographic evidence of degeneration of cartilage, or what we call hypertrophy of bone, somewhere, or generally in the articulating margins of our joints, where our weight-bearing joints are. We would have some evidence of it. Even if we don't know that we have it, it's probably there if we're post-40.
Very interesting. And don't go away. When we come back, more questions with Dr. Wrench, and then we'll send it out to East West College for a demonstration. Stay with us.
Opioids are now a public health emergency in Florida. So what have you been prescribed for your pain? East West College of Natural Medicine understands the age-old Eastern philosophy of natural healing using acupuncture, herbs, and massage. Here, we combine Eastern and Western healing that results in a unified solution, individually tailored for you.
Massage is a powerful tool. It can alleviate pain, heal injury, and support well-being. East West College of Natural Medicine can prepare you for a career as a massage therapist. Our curriculum combines Western and Eastern massage therapy approaches, and the program includes an internship and job placement assistance. Launch a career you can feel good about. Start at ewcollege.edu. East West College of Natural Medicine, nurturing careers in the healing arts.
Welcome back to Natural Healing with Oriental Medicine. We're talking about treating back pain, and Dr. Wrench, we're about to see a demonstration about treating this issue.
Dr. Brandon Fuller at the college is going to do a little acupuncture on one of our student/patients, and I think we'll also see some injection therapy. We call it acupuncture point injection therapy. He'll be injecting a little homeopathic substance as he treats his patient today.
We're looking forward to seeing that. So now let's go out to the East West College of Natural Medicine and see a demonstration treatment up close with Dr. Brandon Fuller.
Thank you, Grant. Hi, I'm Dr. Brandon Fuller from East West College of Natural Medicine. And today I'm here with Wyatt Jenkins. And we'll be performing some of the orthopedic evaluations and some acupuncture and Oriental medicine related to spine pain. So Wyatt, today, for starters, we're just going to go through some basic range of motion. So if you could just bend forward for me and try and touch your toes. While we do this, in medicine, we look to see what the actual rate of bend there is, or the degree of bend. And this will give us an indication of how far he can possibly bend and how far he can move. So Wyatt, I'm going to have you bend backwards slightly for me. Good. And is there any pain associated with this? No. No, great. All right. And this time, what I'm going to have you do as you bend backwards, I'm going to have you place one hand, and you're going to slightly rotate and bend backwards. It's reaching for the back of your knee, almost. Is there any pain associated with that? No. No? All right. Good. And how about the other side? Doing the other side. No, nothing. Great, great. What actually happens here, this is called a Kemp test. And during the Kemp test, it's almost like when we were just going backwards, but putting a little bit of rotation on the spine actually closes the little holes that the spinal cord comes out of. And it can cause a little pinch on some of those nerves. So as we do this, this might indicate that there's a possible impingement of some of the spinal nerves that are coming off the spine, and we might have a radiation of pain down the leg. All right, Wyatt, I'm going to have you lay face up for me on the table, please. And what we'll be performing now is called a Fagerstans test, right? And this will indicate if there's any low back pain. It's really subjective and objective, straight for L4, L5, L5, S1. And it'll tell us if there's any disc pathologies there. All right, so Wyatt, I'm just going to dorsiflex your foot here. Great, and I'm going to raise it up. So we do this on the unaffected side. Is there any pain that radiates down this leg here? No? Great. All right, excellent, excellent. Now, if there was pain that radiated down this leg, that would definitely indicate a disc pathology, right? All spine problems doesn't necessarily mean you have osteoporosis or a herniated disc. There's lots of multiple diagnoses for back pain. It could be muscular, right? Wyatt could have a muscular pathology in his back, and it's more of a spasm. And so doing these orthopedic evaluations helps us to rule out any pathologies that may need further imaging for us to fully diagnose it. All right. Wyatt, if you can sit on the edge of the table for me, please. And what we're going to have you do is what's called a straight leg raise. All right. So I want you to raise this leg for me first, straight out. And is there any pain in your low back area?
I don't feel any.
No pain? Great. Great. Now I want you to slump your head to your chest and raise your leg again. Is there any pain here?
I don't feel any pain.
Okay, good. A little bit of tension maybe? Yeah. So with this test, it's called a seated straight leg raise. And this straight leg raise, when just raising the leg by itself, puts a little bit of strain on the sciatic nerve, right? It's kind of like if you have a loose rope and then you tighten it slowly, right? And what happens when you slump your neck is that all of the spinal cord there puts a little bit more tension, so that nerve will have that just a little bit of extra tension on there, and that'll definitely indicate if it's a nerve pathology at that point, if there's a radiation down the leg. All right, Wyatt, I'm going to have you lay face down for me, and we're going to perform some acupuncture and some injections for you to help with your back pain today. Okay, are you comfortable? A little bolster? Sure. There we go. And how's that? You're welcome. So when it comes to back pain, there's multiple acupuncture points just for back pain alone. Today we're primarily looking at low back pain, but we can also do this for neck pain, right? We can do active range of motion, passive range of motion. We have other orthopedic evaluations that can show us exactly what vertebrae are a problem area. Right. So as you've seen in the past, our acupuncture is slightly painless, right? There's almost no pain to it whatsoever. There might be a little dull aching sensation, which is normal, right? So our needles are actually hair-like. And I like to use a little distraction method, which kind of distracts the patient from any tapping or any puncture with the needle. And as we do this, we'll hit specific acupuncture points that help release any muscle tension. There could be other diagnoses that we as acupuncturists will figure out through questioning. But for today, we're just going to demonstrate some acupuncture points. There are some acupuncture points located directly along the spine also. So with this, we can needle these specific points to help reduce inflammation. And it can bring a positive blood flow to the area to help push out some of that stagnant blood that might have gotten trapped in there and was trying to heal. Fresh, revitalized blood is always better than having something that's stuck there and just not moving, right? Other acupuncture points are right beside the spine that we can do. And so what we'll do here is we'll go just beside the spine, and they're a very old ancient point called Jiaji points. And these Jiaji points will help to reduce inflammation if there's any nerve impingements, if there's any impingements right along that spinal cord area. All right, we can also do distal points. And what we do with distal points is we have actual acupuncture points that we learn throughout our studies that help with back pain. Right, so there's some right here in the back of the knees, there's some in the hands, there's some in the feet, around the ankles. We can use these points in succession with a local treatment to help reduce any pain that there may be. Right. Wyatt, how do these feel?
They feel great.
Good. Good. So in conjunction with this, we may do moxibustion, we may do cupping, we'll definitely do some form of injection for him, and as acupuncturists, we can only use what's all natural. So we'll use a homeopathic, which won't interfere with any medications that a patient may be on. It will also help to reduce any inflammation in that area, help bring new fresh blood flow in. Right. It can be anti-edematous, meaning reducing any swelling in the area. Right. So in finale for this, we can use this to help reduce inflammation and to help restore functionality to a patient. So in a second, we'll snap to show you the injection that we might use. We use a very, very thin, small needle. Most patients will ask, wow, you just gave that injection? They have no idea that we're giving an injection when we're doing it. It's so fine. All right. So Wyatt, we're going to swab your back here and get you prepped for your injection. A little cold from the alcohol. And so as we do these injections, we'll usually have our patients show us exactly where the problem area is. We may mark it with a surgical marker, then remove it with alcohol. And then we'll just tap on the skin lightly, and a little bit of solution. And then go to the next place. All right. And so that concludes our spinal area demonstration for today. But I'd like to thank you. And if you have any questions, please come in to see us. We can help you with orthopedics. We can even send you for MRIs if you need to further evidence of what's going on. Or we can come in just to help you with any back pain, even if it's a muscle spasm. Thank you. And back to you, Grant.
Okay, so Dr. Wrench, we've just seen this demo. A lot of things happened there, but so any patient could come in and get the same type of treatment.
Yeah, well, the important thing to find out exactly, as we said, the spine is a very complex mechanism, Grant. So first we have to find out what the problem is. And remember, again, from prior shows, we've talked about this at length. I call them the 4 pillars. And number 1 is that determines the success or maybe lack of success of a treatment strategy is how old is the patient, what exactly is the problem, how long is the problem, the longevity, is it 3 weeks, 10 years, 20 years, and how severe is the problem they're having. So when patients often say, how many times do I have to come? And I go, well, I'd love to be able to answer that, but I'm helpless without a crystal ball. So let me tell you the reality: age, problem, severity, longevity. And once we do that and some orthopedic testing, we can better understand what we're dealing with and make a better prognosis.
And don't go away. More questions with Dr. Wrench when we return.
Opioids are now a public health emergency in Florida. So what have you been prescribed for your pain? East West College of Natural Medicine understands the age-old Eastern philosophy of natural healing using acupuncture, herbs, and massage. Here, we combine Eastern and Western healing that results in a unified solution, individually tailored for you.
Massage is a powerful tool. It can alleviate pain, heal injury, and support well-being. East West College of Natural Medicine can prepare you for a career as a massage therapist. Our curriculum combines Western and Eastern massage therapy approaches, and the program includes an internship and job placement assistance. Launch a career you can feel good about. Start at ewcollege.edu. East West College of Natural Medicine, nurturing careers in the healing arts.
Welcome back. I'm talking to Dr. Wrench. We're talking about treating back pain, and we've already seen the demonstration. So my question is, can acupuncture be used alone, or there are other complementary treatments that can be used with these modalities?
Well, if you're talking about in terms of traditional Oriental medicine, there are many things that we can do to complement a treatment. But I'd like to back up very quickly to something we touched on earlier. We talked about patients getting relief from, say, chiropractic, patients getting relief from physical therapy. Acupuncture is, as we always say, complementary. It can be used either alone or in addition to other adjunctive therapies.
So it can enhance other treatments.
Absolutely. It works great with chiropractic. It works great with physical therapy. Now, in and of itself, as we talked about in prior shows, we can do cupping, we can do the moxibustion, the burning of the warming herb near the painful areas. We can do electrical stimulation.
So these could all be at a treatment at your clinic, and these adjunctive therapies that you just spoke of, the cupping, the laser, the injection therapy, all could be used in addition to acupuncture.
And quite commonly they are. In my estimation, we almost never just do acupuncture alone. We almost always do other adjunctive therapies with it. And in the case of debilitating back pain, our job as physicians is to try to send that patient out the door in a whole lot better shape than they came in, if that's possible.
And as far as that goes, when we talk about treatments, you touched on it earlier, but this could be twice a week, this could be over a couple of months. It would depend on the patient, of course, but what's kind of the the routine that you would set up for a patient who's dealing with, let's say, lower back pain caused by a herniated disc or something?
Sure. Well, it depends on the mobility of the patient and are they able to get to the clinic twice a week. So, some people say, I can't drive, I'm in great pain, and so on. But generally, 2 times a week for 4 weeks, and then we reassess. If they get better in the interim, then we discontinue treatment, or we may offer what we call like a maintenance once a month for a while.
Now,
Go ahead. I'm sorry.
Yeah, no, but in the demonstration, I just wanted to ask this. We saw that patient or the student face down on their stomach, but is this the only way you can treat a patient, or is there another approach as far as the acupuncture?
Absolutely, and that's the beauty of this medicine. You're able to treat them in a face up or on what we call lateral recumbent on their side. Many patients report, I cannot lie on my stomach at this time.
Because of pain?
Absolutely. We also can treat, we use a chair that leans forward like a massage chair where they can tilt forward and their face is in a rest and they're very comfortable.
Takes the pressure off the back.
It does, and we can treat in that position, and frequently we do.
I see. So, and in that case, it would be the same type of approach. They would just be in a different position.
Yeah, certainly there are points we'd like to access, but they're like buttons on a computer. If we can't push this one, there's something else we can do to run a program. So when we can't access certain points, we substitute other points that will pretty much do the same thing.
Now, when you're using the acupuncture needles, are you always just, do you say, where does it hurt, and is that where you're putting the needle, or does this go into more detail than that?
Excuse me. No, there are points that are generally, we have an expression where there's a pain point, there's an acupuncture point. But also we have points that we know after thousands of years of trial and error that do specific things.
Proven techniques.
Absolutely, and points that affect specific areas of the body. So while we may go to what we call command or control points, we will also go to points that are just specifically non-specific acupuncture points, but just happen to hurt a great deal.
And let's talk about, in some cases, could we be looking at 5 to 10 needles in a treatment for lower back pain, or would it depend on the cause of that pain?
It would depend on the cause of the pain, and so it's almost impossible. Now, we can do a minimal treatment where only a few needles are used, and sometimes we do, it's very non-invasive. Sometimes we'll use more. Again, it depends on the person, the problem they're having, the age, and so on.
And that's a great segue. So how would viewers go about scheduling an appointment to be treated for back pain or anything else that they might be dealing with?
Just call the college, 941 355-9080, and ask for the clinic desk. We'll set up an appointment. We'll do a consult with you,
and
we'll
you have
take
a
care
website.
of you.
You're up on the North Trail
That's correct.
of
We are.
Sarasota. Very easy to find.
Been here 20 years.
And thanks for joining us. We'll see you next time.